Coach Tess from HealthEversity, and today we're going to do a short video this time of nerve and endocrine system. So as I always, when I start with the videos, I always do the same thing or say the same thing for you. So for people who have never watched any of the videos before, this video is to help you with your CPC board exam. Now we're dealing with keywords for the nerve and endocrine system. Okay, so let us jump right into it. So the keywords are words that will help you with your accuracy on the test. So for you to identify some of the procedures versus your diagnosis versus your anatomical sites. Some areas of it is a lot more challenging than others. So it's best you get into the habit of going to the back of your study guide, picking out, to differentiate between your diagnosis, your procedure, and your anatomical site. And it's very, very important, okay? Because you might read a scenario or a question and you don't know some of these terms. And the book that we're using, this book right here, is a content from AAPC. And I normally have some nice, cute highlighters that I got from Walmart. See, colors of the rainbow. All right, so let's get into it. So this is pretty short and we're going to go through it pretty quickly. All right, so the actigraphy testing, and that is a procedure, right? Anastomosis. Anastomosis is a surgical connection between two hollow structures. So now we've seen anastomosis in cardiovascular, we see it in digestive, we see it in urinary, and now we see it in the nerve. Okay, so anastomosis is right here. Chemodermovation is the interruption, and that's a procedure too. Interruption of messages sent between nerves and muscles by administration of a chemical substance. Okay, injection of an enzyme. So you have chemonolysis, cranioplasty. You'll see that most times you will see that possibly on the test. Surgical repair. So remember, you have plasty and you have cranial. Okay, so that's the skull. Cranial, so is a repair of the skull. Decompression. Decompression, emphocelli. So emphocelli, all right. You have F wave, voltage change, that's a procedure. So this video is very, very short. We don't have much keywords in here, which should tell you, remember, this is a 60,000 series. So you'll find that you have nerve, eye, and ear. So this is where we're going to just do just nerve alone, so you can focus on that one. Okay, so you have H-flex, meninges, that's A and P, right? And collective name for all the membranes enveloping in the central nervous system. All right, meningocephaly, myelomeningocele, that's a birth effect, and that is, so that is a diagnosis. Okay. Osteomyelitis, acute bone infection, so that is a diagnosis as well. Spine tap, that is a diagnosis. All right, stereotactic head frame, a guidance position the head for precise treatment during the stereotactic radio, that is a procedure. Oh yeah, I told you. Did I say spine tap? Spine tap is a procedure. My bad. Sorry. Okay. And the osteomyelitis, it is a diagnosis. All right. Transection, to divide, cutting transversely, a cut across, which is transection. So you're going to see that in other sections as well. Okay. All right. So let's see what we have here. Vaspasm, it's a diagnosis, right? Zygophallocele joint, that is a anatomical site. And then guess what? We're done. You see how quick and easy this one is? So because you're going to divide it, we're going to do nerve. In the 60,000 series, we have the endocrine, the nerve, the eye, the ear, and the adnexal. So next video, we are going to be doing eye and ear. All right. Have a good one.